but the rest are now ready for our commissioning. We've also rehabilitated and retooled some aspects of Tetekwashi Memorial Hospital, Atibie, Aburi, and Chibi hospitals in the Eastern region with Dutch Bank funding of 40 million euro. These have been completed, and we will soon see commissioning of these projects. We have completed the Tamale Teaching Hospital Rehabilitation Project with Netherlands ABN AMRO Bank facility. During the COVID-19 pandemic, the ministry, you're aware, received some funding from the World Bank for construction and rehabilitation of treatment and holding centers in 14 locations in Ghana. 9 out of the 14 centers are completed, while the remaining ones are nearing completion. Don't know if I can get a slide to quickly go over the treatment centers because of interest. We have 2 in Kolebu alone, the Fevers unit and the Kolebu emergency treatment center. These have been completed and they are ready for use. Okay, move ahead. We have done one at Pantan. Pantan, we did 2 projects there, the Learning Center and the Pantan Treatment Center. We decided to refurbish those facilities to use as isolation centers, but because COVID is now gone, we may have to find some use temporary until another serious emergency comes back to us. Sewa, where we are putting the regional hospital, just close to it, we again put another treatment center. These are apparently isolation centers for treatment. We continue. The National Vaccine Institute, that is part of the new investments we are making into vaccine manufacturing. We can go ahead. If this is all, let me continue to mention some more. I said earlier on that 9 out of the 14 centers are completed, where the remaining ones near completion. We try to put the treatment centers across the country. So we have one at Zebila, the Adekulu, one in Volta region, one in Sunyani, one in Goso, one in Dodua, the Shant region, one is in Sewa. So we covered almost everywhere. The Western North has one, is it Yoso or close to Yoso. So that is how we distributed some aspects of the COVID investments across the country. We also have completed 16 new chip compounds projects in selected locations across the country. Despite these, we have a number of uncompleted projects that we are seeing work in progress. They're a bit slow now because of inflows that are getting to the contractors' hands, but with time, these projects will also come to completion. The equipping of Komfanochi Maternity, completion and equipping of Komfanochi Maternity and Children's Block with funding of 38.5 million from Dutch Bank. This is about 56% complete. That was the old Komfanochi Maternity Block that was 44 years old, uncompleted. We tackled it, and we are getting close to about half complete with that project. The Bolga Regional Hospital, that has also been there for a very long time. We are now around 96% complete. We left with fixing equipment, and soon that will also be commissioned. The Eastern Regional Hospital has seen significant progress, which is now close to about 56% also complete. We started Ifyankwanta Hospital on their rehabilitation, and we are also constructing a new Western Regional Hospital with funding of around 190 million euro. This is just 15% complete. Other ongoing projects, Urology and Nephrology Center of Excellence at Kolebu, 55 million euro financing from Dutch Bank and TMF Global Services Limited for district hospitals at Obuasi, Enyinem Trauma Center, and AUNC Hospital projects. We have secured funding for La and Shama Hospitals projects, and work will soon recommence on these projects that we stopped, especially La. The ministry has also received approval for 400-bed maternity block for Kolebu Teaching Hospital, 5 new district hospital projects, the rehabilitation of Tema General Hospital, Nkranza, and Doma hospitals, as well as the construction of a new central medical stores for the ministry. We still have some other projects in the pipeline. Financing and renewal of the Cape Coast Teaching Hospital, including the new Accident and Emergency Center. Construction and equipping of the Greater Accra Regional Hospital, RAGE Phase 2. Retooling of selected public health facilities across the country. Accelerating TB case detection project, Phase 2. Redevelopment of Pantan Psychiatric Hospital and maternal and child health services and obstetrical emergency improvement project. Our way forward. We'll continue to pursue service delivery interventions using the life course and One Health approach to achieve universal health coverage for all. We will strengthen the whole of government and whole of society approach to healthcare delivery. We'll continue to build a better and efficient health system to respond to public health emergencies. And we'll reposition the health workforce strategically for the completion of the Agenda 111 projects and manage the migration issues to the benefit of Ghanaians. We will continue to complete the rollout of the e-health platform to the lower health facilities in line with the government's digitalization drive and ensure improved accountability mechanisms in the sector. Let me thank you at this stage for your attention. I'm grateful.
Honorable Minister, thank you so much for that insightful presentation. In fact, when Minister read all the infrastructure projects, I was struggling to catch up because there is so much that the ministry has achieved within that period. I must say that the ministry has done so well in terms of HR, in terms of digitalization, in terms of improving the NHIS to mitigate all the financial challenges that low-income families or the general public may go through in trying to access health care. But about the infrastructure aspect of the presentation, because I remember before Minister's appointment, I visited the Seria Hospital ground, and it was just earth. It's just some few pillars and just earth. And today, when you get to the place and they say even 96%, you say, oh, maybe they are just waiting for landscaping. The facility is up. It's not in any book. It's not about artistic impression. If you go to the various project sites, really, you will see that the ministry is working. And I will also count on Minister to make more investment in production of corporate videos and materials, just so that we can improve the communication within mass media, because a lot has happened and there is no reason why anyone will say, oh, we have borrowed, we don't see what we've used the money for, when we can't even catch up with Minister's presentation. That was so rich and so masterfully delivered. And Minister, I would like to thank you for that. On that note, ladies and gentlemen, I believe Minister has said it all, but if you still have any questions, kindly mention your name and affiliation and then proceed to ask the question. We'll bring the microphone to you if we see your hand up. If anyone has a question, please, this is the best time to ask. Yes, Paul. Okay. I can see two ladies at the back, and then okay, we can start with the ladies. So kindly mention your name and media house and then proceed to ask your question.
Hello, my name is Sarah. I work with TV3. I would like to kind of comment aside. I think we keep hearing that funds have been secured for the National Hospital in Shaman. Projects will begin, but it's still the old story. If it would be very specific this time around for us. Thank you.
Thank you for the question.
My name is Sarah from GTV. It appears the Minister's presentation was speak to just a few sectors in the health arena. not satisfied. But I want to find out whether this assessment should be in consideration some projects being embarked upon by a private sector in the health for us to also know the level of completion with such things. I will recall the cardiothoracic center that 37 military hospital. I want to find out the states of this. And also the phase 2 of the Greater Marina Hospital. I haven't heard anything about that. We want to find out the current state of it and when government hopes to start. And we also know that the 111 is not under the Ministry of Health. So we are able to even ask pertinent questions from the Ministry of Health. We want to find out whether it's in terms of the time, the duration for the completion of the project, whether they are going to achieve the set targets here.
Okay, thank you for the questions.
Good morning. My name is Paul Nyojadalafu, and I represent the Daily Statesman. Thank you very much, Minister, for your presentation. My question is, I want to find out from you, what is your response to the claims by the Fourth Estate, which was published within this week, that free childhood cancer, despite promises made by government through the Vice President and the First Lady, has not been implemented? Thank you.
Okay, we can take 2 more questions for this round if there are any hands. Okay, please.
Good morning. My name is Akokraba Kasapa FM. Minister, I want to find out from you, how are you regulating the private training colleges, private health training colleges? Because there are many times that these institutions offer almost about 6 months, 1 year, and they train these nurses, and they add up to the numbers, which our health cannot be jeopardized. So how are you regulating them? And then also, sources tells us that almost about 10,209 nurses have been trained, and they are yet to be posted. What account for these numbers? Why are they still home? And what account for those, And finally, I want to find out from you, Minister. The brain drain has been a worry to our health sector. You've made mention that even though efforts are put in place to ensure that these nurses are kept in this country and then work for Ghana, one of the few activities or one of the major causes of this brain drain can be attributed to the fact that their salaries are considered meager. What are we doing about them? Thank you very much.
Thank you for the questions. Okay, let's take that as the last for this round and go for Minister's responses.
My name is Augustina Teria from the Daily Graphic. The minister did mention of a migration policy that they are working with the Labor Ministry. I want to ask, how soon will this policy be in place? And in the interim, what is the ministry doing to retain the nurses that are leaving the country? Thank you.
Thank you for the questions. On that note, I will invite Honorable Minister back for his responses, and if there are any follow-ups, we will come back to you.
Thank you, my sister. We are collaborating very much with the private sector. On briefings like this, we take information from private sector. The type of information we get, we put forward. In this particular instance, remember I said that we're concentrating on 3-4 aspects of our health sector focus. So there isn't much on private sector. We have a very huge collaboration. We are renewing our relationship with the private sector to support us to deliver care in our country. So private sector, we are working with them. We haven't forgotten about them. We are not leaving them behind. We are working hand in hand with the private sector. Our next briefing, where we're focusing on different areas, we'll try to see how we can bring in private sector and let them also come and tell us what it is. Phase 2 of Greater Accra Regional Hospital. I think I mentioned that we are frantically looking for sources of funding to continue to do that. We've done so much in several areas, but that is an outstanding issue we are working on. we started meaningful negotiations and discussions in trying to see how we can get funding to continue to do that. La and Shama, we got funding. Unfortunately, something happened. We couldn't continue that way, and we got it stuck there. If you can show us a slide for La, for example, we started working seriously on La, and we still have contractors' material sitting on site. We are now shifting the source of funding. We've virtually completed negotiations. We are getting reinforced designs and things like that. And soon, that is why I said La will come back on stream. This is where we go to. And the contractor is even still on site. Only that funds flow has made it slow down a little bit. But we are shifting the source of funding, and soon some good work will commence in La. And that will relieve me a lot from the criticisms that I've faced for pulling down La. That was virtually collapsing itself. Ejeda 111, I'm glad you said that you now realize that it's not solely in Ministry of Health, because of the significance the President attaches to his vision. This project was actually situated under the presidency. There's some health infrastructure group that is undertaking that. And I believe that they came to give a briefing here on where they were not very long ago. So that question should have actually been there. I'm very, very optimistic that they will achieve some targets that have been revised. Earlier on, we were thinking they will complete all the 101 hospitals by 2024. Unfortunately, because of procurement processes and delays in signing agreements and pushing contractors here and there, the targets have been revised. And when they come in for the next briefing, you will get it. I don't want to mention numbers. They themselves will tell you where we are. But what we have revised these targets to, I believe it's achievable, and they can achieve the targets. Childhood cancers, we had some little problem. We've had a good engagement with providers and the National Health Insurance Authority, I think last 3 weeks in the ministry. And all those centers that have been identified to do care now are doing care that will be paid for by health insurance. So we have jumped the hurdle in that respect at the moment. The private health training institutions, I don't understand when you say how we regulate. We are regulating them like we are regulating the public health training institutions. And mind you, the private health training institutions include some of the universities that are running courses in nursing and midwifery and what have you. Prior to my government coming into office, there was a government policy that refused to employ or recruit nurses who have gone through private sector training facilities, though they might have passed their professional exams. It took us about a year to be able to actually negotiate to get funding to be able to start recruiting them. As I speak, the numbers that I mentioned includes all private sector trainees, those who have passed through private sector health facilities. Unless, of course, those that have not been licensed, those that have not been accredited, those that have not been properly registered. So we regulate them just like all other public facilities. Nurses yet to be posted. What accounts for this? Other university graduates that have not been posted. What accounts for this? The answer is the same for the nurses as well. We begin to forget that when you finish university and you pass the exams, you also have an obligation to be employed. Somebody has to find you a job. Just like the nurses. The nurses are very lucky. Or probably they chose places where they can easily find jobs after completion of college. We have done the best that we could. But it looks like we are training large numbers on an annual basis. And their holistic 100% recruitment doesn't seem to be sustainable. This is a fact. If you look at our budget and you look at the payroll component of our budget, you can't continue putting in 30,000 new employees every year. So that is partly explaining why some of them are still at home. We wait for financial clearance from Ministry of Finance. The budgetary constraints does not allow Ministry of Finance to give us financial clearance to employ, to recruit. Our hands are tied. We don't seem to have nothing to do. But as I speak, we have recruited some portion of you in 2022, and we are waiting for financial clearance to do the rest. they may have to wait a little bit, a while. As for doctors, I will be surprised if I can hear that some of them are sitting at home 2-3 years without jobs. That is no more the case. We recruit them right from their internships, their housemanship. They go straight onto payroll. We get them posted, and they are now in large numbers to support our country. The brain drain matter is a pull and push factors. And somebody was talking about salaries are not very good. Those of us sitting here, including even me, Ghanaians, how many of us are satisfied and comfortable with our salaries? The opportunity is out there now. Before COVID, were we talking about brain drain of nurses? After COVID, there is a massive global health workforce shortage. So an opportunity has been created, and therefore those who are adventurous would like to take advantage of what opportunity is elsewhere. Government started managing migration in small quantities from Ghana to Barbados. We have sent 2 cohorts of 125 in the second instance to Barbados. There are other countries that are knocking at our doors to try to see if we can offload some of our nurses to them. That is why we said that we are working with the Ministry of Labor and Employment, is that correct? Employment and Labor Ministry, to see how we can manage migration. Sign bilateral engagements, memorandum of understanding, said that those who like to go will go in a very diplomatic, defined, decent manner. And that is what we haven't completed. It takes some time to work on this. So health alone cannot do this because we don't have those who have the expertise in this managed migration issues. But so far as we have about 90 training colleges, that is minus the private sector ones, and the universities that are training nurses, we will always have some good numbers of these nurses. So the new strategy is that why don't we engage those who need some of these nurses to see if you can hold their hands along like we did with Barbados for them to go and work and bring home money and bring home some expertise, some other learning skills that they might have got from outside. But we are cognizant of the fact that we can't deplete our facilities with the most experienced ones. So we are looking at how we manage to keep those here and then see how best. Some can also go out and acquire some more training to come. When we even haven't finished, some are going, but we are tracking those. The numbers are not that huge yet. On the last count, sometime last week, Ghana Health Service has lost about 1,400. And the charge people have lost close to about 600 or so. These are official numbers that we know of. Some are vacated. They are living without about a month or two when they have vacated their positions that we record them. So the numbers officially that we have is not very, very huge. And we are not getting very serious distress messages from the facilities that if you don't bring new ones, they can't work. So we are managing the situation, and we have not got to a situation where we seem to have so much distress with this type of, do I describe it as illegal migration by our young people who want to be adventurous to go and see if they can find some fortunes to bring back home. The policy, how soon will it be completed? It will be difficult for me to give time frames because we have an environment that is not controlled only by Health Ministry, and then we're doing massive stakeholder engagements. So how soon it will be, hotel. But we started working on it some time back. I don't think it will take too long for us to complete what we are doing. I think I've answered all these that were picked up. Thank you very much.
Okay, please, if you have any questions, we will take one last set. But if there are no questions, then it means we have to invite. Okay.
My name is Isabella Jakwa with the Daily Statesman. In the minister's submission, I didn't hear him touch on the mental health sector and also on any interventions on the mental health sector. And a consultant psychiatrist is calling for an imposition on taxes on alcohol, cigarettes, so that these monies can be directed to the mental health fund. I want him to respond to this.
Okay, thank you for the question. Yes, sorry. Yeah.
Okay, so my name is Sarah Furi again. I want to find out from the minister. The minister mentioned that there was an arrangement with the UK government where Ghana stood to gain some dividends with nurses being migrated and all that. I want to find out the state of that agreement. And also, he didn't touch on childhood vaccines. I don't know whether our current stock is still enough for us to vaccinate our children. And also, I wanted to find out from him, when the COVID Trust Fund team were over and done with your work, why didn't the ministry advocate that the monies be put into other health projects instead of returning it to the consolidated fund? Yeah.
Okay, thank you for the question. I can't see any hands, so I take that to be the last question. So I will invite Honorable Minister back for his responses and also his concluding remarks.
Thank you, my sister. COVID fund, the minister advocating for it to be put into health infrastructure only. When COVID hit us, the activities that the entire COVID task force advised for us to undertake, they were all not in health alone. Remember, even when we were quarantining people at the Pentecost Center, we had to bring in national security and the police service. When we're looking at how we can support businesses that were going down under because of COVID, we have to fall on the Minister for Finance to give some small support to small businesses that were collapsing. So if you set up a COVID fund and the health minister alone goes to say that bring me other money, I don't think you'll be asking for equity. So you look at where gaps were created, look at what other things that money can be used to do to support us, but not only in health. If you look at the type of infrastructure and the things that I mentioned, we were trying to put up 14 new facilities. We call them treatment centers, holding and treatment centers. That investment was big. Then you still go and ask for more. Look at all the projects that I mentioned being funded again from the consolidated fund. There were several other things that we haven't even done as a nation. So there are talks now asking for the fund to do several other things. This morning, just before I got here, those who are working on the emergency preparedness policy are asking that why don't they give us all that fund into emergency preparedness. That emergency preparedness center we want to create will not only be for health issues, but even natural disasters, fire outbreaks, floods, and all that. So if you put all that money into health, I don't think we'll be doing this nation some good. The Ministry of Health will benefit anyway, but we are talking. At the end of the day, Cabinet to make a decision as where to go. But let me advise or remind you that wherever I am and we are discussing of where to put money, I don't think I'll keep quiet. I'll advocate for health to be given a fair share of that funding. Childhood vaccines, let me tell you, our challenges are now over. We have adequate stocks. We are looking at the stock levels on a weekly basis. We have some good allocation now to do vaccines, and I don't think that problem we faced is going to happen in the very, very near future in the country. Migration to UK, we are still engaging people. But you see, You are knocking at the doors of somebody. He has come to you to negotiate. What he wants, even when you haven't completed, he's getting. So what will be their enthusiasm to push you to do it? So we are becoming a little bit slow. We are working on it anyway. Within the next few months, I believe we'll come out with a completed arrangement to guide that march. So we are working with the UK government, not only UK government. Yesterday we had a briefing with some group from the US who are also looking at whether they can take some of our nurses away. But these things take a little bit of time to negotiate, to get your foot going. Taxes on alcohol and cigarettes, we call them sin taxes. This has been a very old advocacy thing. All the time we're talking about taxes on alcohol and cigarettes to stop their use and all that. What did we put taxes on? And somebody was complaining, just last week or so. Something that we have put taxes on, something, I don't know. Even me standing here, when I was in opposition, the other time they talked about taxes on alcohol in Parliament. I got up and said, hey, you are not taxing Apeteshe. You see, that sort of thing. It has been an old thing. And year on, governments look at what they can do to put on some taxes on these things. It's an old age phenomenon on these. It's only last 3 weeks when I was in Lagos on cardiovascular research findings that the researchers are saying that we always talk about alcohol and cigarettes and sugar. What about sodium, salt? Then the place went quiet. The place went quiet. So now, can we be bold to ask anybody to put tax on salt? But that also is hazardous to our health, somewhat. But it takes, certain situations and certain times to be able to introduce some of these things. We know what it is and how it can help us fight diseases. Mental health sector. Remember, I said the focus of this briefing were in 3 key areas of health. Little I can say is that we are seeing some good improvements in funding for mental health, and some new activities are actually coming up into mental health. At the appropriate time when we meet you next, I think we will create space to actually brief you on what bold steps we are taking in the front of mental health. I thank you so much.
Honorable Minister, ladies and gentlemen, I was so excited throughout Minister's presentation to share some good news with you, but I said let me allow him to go through the serious business. But today is Minister's birthday, and I would like all of you to join me on behalf of Honorable Kojo Okpon-Nkrumah, our Chief Director, Management and Staff, and all our guests today to wish the Minister of Health, Honorable Ajimamenu, a happy birthday. Honorable Minister, I have personally admired you so much, especially in Parliament, at the plenary and committee level, and the depth of your presentations and all that, and to see what you have done with our health sector. We are also proud of you. May God bless you. Happy birthday.
So you all wish me happy birthday.
To you. Or maybe we need someone with a good singing voice.
It's okay. As for baby song, that's outside. Happy birthday to you.
Ladies and gentlemen, on that note, we thank you so much for joining us for this important exercise, especially to the press. You have seen everything that Minister has demonstrated and all the things he has said, and the evidence that he has shown on the screens. We can only count on you to help us spread the information so that people will appreciate all the investments that have been made within the health sector. To GTV crew and those at the studio, thank you so much for always carrying our press briefings live. We hope we can get a lot of people to watch this briefing and see all the wonderful things that Honorable Minister through this government has achieved. Thank you and enjoy the rest of your day.